Hi everybody, this video of mine is about cluster headaches. Cluster headaches which occur in cyclical pattern or cluster periods are one of the most painful types of headache. A cluster headache commonly awakens you in the middle of the night with intense pain in or around one eye on one side of your head. Bouts of frequent attacks known as cluster periods can last from weeks to months, usually followed by remission periods when the headaches stop. During remission, no headaches occur for months and sometimes even years. Fortunately, cluster headache is rare and not life-threatening. Treatments can make cluster headaches attacks shorter and less severe. In addition, medications can reduce the number of cluster headaches you have. Now I'll tell you the symptoms. A cluster headache strikes quickly, usually without warning, although you might first have migraine like nausea and aura. Common signs and symptoms during a headache include excruciating pain that is generally situated in, behind, or around one eye, but may radiate to other areas of your face, head, and neck. It is usually one-sided pain, and you may suffer from restlessness, excessive tearing, redness of your eye on the affected side, stuffy or runny nose on the affected side, forehead or facial sweating on the affected side, pale skin or pallor or flushing on your face, swelling around your eye on the affected side, drooping eyelid on the affected side. People with cluster headache, unlike those with migraine, are likely to pace or sit and rock back and forth. Some migraine-like symptoms, including sensitivity to light and sound, can occur with a cluster headache, though usually on one side. A cluster period generally lasts for several weeks to months. The starting date and the duration of each cluster period might be consistent from period to period. For example, cluster periods can occur seasonally, such as every spring or every fall. Most people have episodic cluster headaches. In episodic cluster headaches, the headaches occur for 1 week to a year, followed by a pain-free remission period that can last as long as 12 months before another cluster headache develops. Chronic cluster periods might continue for more than a year, or pain-free periods might last less than 1 month. During a cluster period, headaches usually occur every day, sometimes several times a day. A single attack can last from 15 minutes to 3 hours. The attacks often occur at the same time each day. Most attacks occur at night, usually 1 to 2 hours after you go to bed. The pain usually ends as suddenly as it began, with rapidly decreasing intensity. After attacks, most people are pain-free but exhausted. You should see your doctor if you have just started to have cluster headaches to rule out other disorders and to find the most effective treatment. Headache pain, even when severe, usually is not the result of an underlying disease, but headaches can occasionally indicate a serious underlying medical condition such as a brain tumor or rupture of a weakened blood vessel that is known as aneurysm. Additionally, if you have a history of headaches, see your doctor if the pattern changes or your headaches suddenly feel different. You should seek emergency care if you have any of these signs and symptoms. Now I am going to tell you signs and symptoms which arise from some of the dangerous headaches which you must seriously note down. Okay. An abrupt, severe headache, often like a thunderclap. A headache with a fever, nausea or vomiting, a stiff neck, mental confusion, seizures, numbness or speaking difficulties, which can indicate a number of problems, including a stroke, meningitis, encephalitis, or a brain tumor. A headache after a head injury, even if it is a minor fall or bump, especially if it worsens. A sudden severe headache unlike any you have had. A headache that worsens over days and changes in pattern. Now coming to the causes of cluster headaches. The exact cause of cluster headaches is unknown, but cluster headache patterns suggest that abnormalities in the body's biological clock, that is hypothalamus, plays a role. Unlike migraine and tension headache, cluster headache generally is not associated with triggers such as foods, hormonal changes, or stress. Once a cluster period begins, however, drinking alcohol may quickly trigger a splitting headache. For this reason, many people with cluster headaches avoid alcohol during a cluster period. Other possible triggers include the use of medication such as nitroglycerin, a drug used to treat heart disease. Now let me tell you the risk factors. Risk factors for cluster headaches include sex. Men are more likely to have cluster headaches. Age. Most people who develop cluster headaches are between ages 20 and 50, although the condition can develop at any age. Smoking. Many people who get cluster headaches attacks are smokers. However, quitting smoking usually has no effect on the headaches. Alcohol use. If you have cluster headaches, drinking alcohol during a cluster period may increase your risk of an attack. A family history. Having a parent or sibling who has had cluster headache might increase your risk. Now I'll tell you the diagnosis of cluster headache. Cluster headache has a characteristic type of pain and patterns of attacks. A diagnosis depends on your description of the attacks, including your pain, the location and severity of your headaches and associated symptoms, how often your headache occurs, and how long they last also are important factors. We as doctor will likely try to pinpoint the type and cause of your headache using certain approaches. A neurological examination may help us detect physical signs of a neurological disorder. The exam is usually normal in patients with cluster headaches. Your doctor will use a series of procedures to assess your brain function, including testing your senses, reflexes, and nerves. If you have unusual or complicated headaches or an abnormal neurological examination, your doctor might recommend other tests to rule out other serious causes of head pain, such as a tumor or an aneurysm. Common brain imaging tests include MRI. This uses a powerful magnetic field and radio waves to produce detailed images of your brain and blood vessels. CT scan. This uses a series of X-rays to create detailed cross-sectional images of your brain. Now I'll tell you the treatment of cluster headache. You need to remember that there is no cure for cluster headaches. The goal of treatment is to decrease the severity of pain, shorten the headache period, and prevent the attacks. Because the pain of a cluster headache comes on suddenly and might subside within a short time, cluster headache can be difficult to evaluate and treat, as it requires fast-acting medications. Some types of acute medications can provide some pain relief quickly. The therapies, which I'll tell you, have proved to be most effective for acute and preventive treatment of cluster headaches. Now I'll tell you the acute treatment of cluster headache. Fast-acting treatments available from your doctor include oxygen. Briefly inhaling pure oxygen through a mask provides dramatic relief for most who use it. The effects of this safe, inexpensive procedure can be felt within 15 minutes. Oxygen is generally safe and without side effects. The major drawback of oxygen is the need to carry an oxygen cylinder and regulate with you, which can make the treatment inconvenient and inaccessible at times. Small portable units are available, but some people still find them impractical. The second treatment is triptans. The injectable form of sumatriptan, which is commonly used to treat migraine, is also an effective treatment for acute cluster headache. The first injection may be given while under medical observation. Some people may benefit from using sumatriptan in nasal spray form, but for most people this is not as effective as an injection and it may take longer to work. Sumatriptan is not recommended if you have uncontrolled high blood pressure or heart disease. Another triptan medication, zolmitriptan, which comes with the name of Zomig, can be taken in nasal spray form for relief of cluster headache. This medication may be an option if you cannot tolerate other forms of fast-acting treatments. Oral medications are relatively slow to act and are often not useful for acute treatment of cluster headaches. Then another treatment option is octreotide. This is an injectable synthetic version of the brain hormone somatostatin. This is an effective treatment for cluster headache for some people, but overall it is less effective and acts less quickly to relieve pain than triptans. Then there is the option of local anesthetics. The numbing effect of local anesthetics such as lidocaine may be effective against cluster headache pain in some people when given through the nose, that is intranasal. Then another drug is dehydroergotamine. The injectable form of dehydroergotamine, DHE45, may be an effective pain reliever for some people with cluster headache. This medication is also available in an inhaled form, that is intranasal, but this form has not been proved to be effective for cluster headache. Now I'll tell you the preventive treatments of cluster headache. Preventive therapy starts at the onset of cluster episode with the goal of suppressing attacks. Determining which medicine to use often depends on the length and regularity of your episodes. Under the guidance of your doctor, you can taper off the drugs once the expected length of the cluster episode ends. Here in this preventive treatment, there are some treatment options like calcium channel blockers. The calcium channel blocker agent verapamil, which comes with the name of Calan and Verilan, is often the first choice for preventing cluster headache. Verapamil may be used with other medications. Occasionally, longer-term use is needed to manage chronic cluster headache. Side effects may include constipation, nausea, fatigue, swelling of the ankles, and low blood pressure. Corticosteroids. Inflammation-suppressing drugs called corticosteroids such as prednisolone are fast-acting preventive medications that may be effective for many people with cluster headaches. Your doctor may prescribe corticosteroids if your cluster headache condition has started recently or if you have a pattern of brief cluster periods and long remissions. Although corticosteroids might be a good option to use for several days, serious side effects such as diabetes, hypertension, and cataracts make them inappropriate for long-term use. Lithium carbonate. This drug is used to treat bipolar disorder, may be effective in preventing chronic cluster headache if other medications have not prevented cluster headaches. Side effects include tremor, increased thirst, and diarrhea. Your doctor can adjust the dosage to minimize side effects. While you are taking this medication, your blood will be checked regularly for the development of more serious side effects such as kidney damage. Then another option is nerve block. Injecting a numbing agent, anesthetic, and corticosteroid into the area around the occipital nerve situated at the back of your head might improve chronic cluster headaches. An occipital nerve block may be useful for temporary relief until long-term preventive medications take effect. It is often used in combination with verapamil. Other preventive medications used for cluster headache include anti-seizure medication such as topiramate, which comes with the name of Topamax. There is another option, that is surgery. Rarely, doctors may recommend surgery for people with chronic cluster headaches who do not find a relief with aggressive treatment or who cannot tolerate the medications or their side effects. Sphenopalatine ganglion stimulation involves surgery to implant a neurostimulator that is operated by a handheld remote controller. Some research showed quick pain relief and a lower frequency of headaches, but more studies are needed. Non-invasive vagus nerve stimulation, that is VNS, is another surgical option. It also uses a handheld controller to deliver electrical stimulation to the vagus nerve through the skin. While more research is needed, some studies found that VNS helped reduce the frequency of cluster headaches. Several small studies found that occipital nerve stimulation on one or both sides may be beneficial. This involves implanting an electrode next to one or both occipital nerves. Some surgical procedures for cluster headaches attempt to damage the nerve pathways thought to be responsible for pain, most commonly the trigeminal nerve that serves the area behind and around your eye. However, the long-term benefits of destructive procedures are disputed, also because of the possible complications, including muscle weakness in your jaw or sensory loss in certain areas of your face and head. It is rarely considered. There are some potential future treatments which I'll tell you. Researchers are studying several potential treatments for cluster headache. These include occipital nerve stimulation. In this procedure, your surgeon implants electrodes in the back of your head and connects them to a small pacemaker-like device, that is generator. The electrodes send impulses to stimulate the area of occipital nerve, which may block or relieve your pain signals. Several small studies of occipital nerve stimulation found that the procedure reduced pain and frequency of headaches in some people with chronic cluster headaches. Another technique is deep brain stimulation. Deep brain stimulation is a promising but as yet unproven treatment for cluster headaches that do not respond to other treatments. In this procedure, doctors implant an electrode in the hypothalamus, the area of your brain associated with the timing of cluster periods. Your surgeon connects the electrode to a generator that changes your brain's electrical impulses and may help relieve your pain. Because this involves placing an electrode deep in the brain, there are significant risks such as an infection or hemorrhage. Deep brain stimulation of the hypothalamus may provide relief for people with severe chronic cluster headaches that have not been successfully treated with medications. Now I'll tell you some lifestyle and home remedies. These measures may help you avoid a cluster headache during a cluster cycle. Stick to a regular sleep schedule. Cluster periods can begin when there are changes in your normal sleep schedule. During a cluster period, you should follow your usual sleep routine. Avoid alcohol. Alcohol consumption, including beer and wine, can quickly trigger a headache during a cluster period. There are some alternative medicine options also. Because cluster headaches can be so painful, you may want to try alternative or complementary therapies to relieve your pain. Melatonin has shown modest effectiveness in treating nighttime attacks. There is also some evidence that capsaicin used inside your nose, that is intranasal, might reduce the frequency and severity of cluster headache attacks. I hope you like this video of mine. If you like this video, or if you are suffering from cluster headache, or if you are suffering from any other illness, please post your comment in comment section of this video, and I'll try to reply your comments as soon as possible. And if possible, I'll try to make a video on your illness. And till now, if you have not subscribed my channel, please subscribe it and click the bell icon and select the all option so that all upcoming videos are delivered to your inbox. If you think that my videos provide some sort of benefit to you, please like this video and share this video with your family and friends and through social media. Thanks for watching my video. See you in next video. Bye.